During medical school, you have to choose what specialty you're going to go into, and I chose pediatrics. And I stayed in Jackson and did my pediatric residency at UMC. And it was during those 3 years that I discovered that I loved neonatology. But you have to do additional training for neonatology. So I went to Vanderbilt in Nashville for 3 years to complete my neonatal fellowship. And that was finished in 1994, returned to Jackson, my hometown, and joined the Newborn Associates. Our practice is really has two major components to it. Part of our practice has to do with taking care of the well babies that come into the well baby nursery, making sure they're okay, checking them out, talking with the parents, and then discharging them home with the parents. And there's some routine care involved with that. The other big part that's part of our practice is the intensive care side, where we take care of predominantly premature babies. And that, to me, is what's most exciting for me. That's the majority of what our training is geared towards. So I would say that that's the most exciting part, taking care of the little premature babies and watching them grow and eventually go home. We're trained in a very specialized way to take care of a particular kind of patient. And I view what I do more than as a job. I view it as a vocation, as a calling. And I feel like God has kind of equipped me, trained me, given me a certain mix of talents, demeanor, and so forth to be able to do what I do. So I see it as a service, to serve other people. So I think basically that's what we're getting at, is we're trying to help people who need our particular help. Yeah, well, it's exciting. The parents are obviously joyful, and in many cases they've waited months for their baby to go home. And in those instances, the babies usually start out very small. So you literally get to see them grow, double, triple, sometimes quadruple their size in the few months that they're there. And it's a long, battle. You just kind of have to, stick with it for many, many months. And so at the end, when the parents take the baby home, it's a very satisfying feeling, but mainly to see their joy to be able to take their baby home is a very rewarding thing.